Okay, this is Audrey speaking. Welcome to Hyp+Access's third million match teach-in. I had to double check. Um, and thanks to folks who are here now or joining in the future. My dog is whining in the background. I apologize if you can hear that. Um, Today we have two really great guests here with us that I'm really excited about. We're going to do a little panel, and we're going to focus on care access, particularly healthcare cuts and government instability, which is a very current, real topic. So we hope to be able to share with folks some information, offer a space to ask questions, and talk about um, things we can do to be in this together. I'm going to do my visual description next, right, Al? And then you're going to do the slides. Okay.
Mhm.
So my name's Audrey. I'm in a white room that is lit pink. I'm a thin white person with long blonde and brown hair. I'm wearing some hoop earrings. And yeah, I'll pass it to Elle.
Hey everyone, this is Elle speaking. I am a tall, thin white person with short, fluffy brown hair. I'm wearing over-the-ear headphones, tinted glasses, and a button-up paisley shirt. And behind me is a half orange wall, half white wall, and also a pillow with our beautiful areolar connective tissue illustration by Rafi Dara on it. And I think my cane is visible on the other side of the wall. Um, and I think that's it. We're going to get into slides and then get to our amazing speakers. And I'm going to start sharing my screen to do that. Let's see what is on the screen.
Yes.
Great. Okay, we are here, yes, for our third million match teach-in for Hyp+Care. This opening graphic is against a gradient of dark blue and pink with rolling green hills on the bottom, graphic flowers made up of our pill-shaped Hyp+Care logo growing out of the hills, and the words million match teach-ins for Hyp+Care. And December 2024 through May 2025 are kind of floating in a rainbow across the screen. And maybe we'll extend past May 2025, TBD on that. Go on to the next slide. So this event series is part of our Million Match campaign to launch Hyp+Care. Thanks to an anonymous angel donor, we're matching 1 million through May. So you can check out that campaign with this QR code, and we'll talk about that just a little bit at the end. But today we're really focusing on the situation happening with healthcare and other resources. Right. So today we are talking about care access, healthcare cuts, and government instability. As Audrey said, this is our third teach-in. We're here together on March 5th, 2025. And folks will also be watching this asynchronously into the future. And on lots of these slides we're going to be looking at, there is a rolling, curving blue to pink gradient across the bottom with our goopy connective tissue inspired H logo on the bottom left. Right. So some accessibility info. We talked about some of this while we were welcoming before we started recording. Auto captions are on. If you haven't already turned them on, folks here live with us on Zoom, you can do that through the little CC button at the bottom of your screen or by navigating there through the little 3 dots menu. If you're on mobile, we are going to try to speak slowly so that auto captions can be as accurate as possible. And please let us know in the chat if you're having trouble following along, and we'll try to slow down. Speaking of the chat, we're going to read as much of it as possible aloud, but only messages that you send to everyone. So if you send it to all participants and we have time and it's kind of relevant to what we're talking about, we're going to read those aloud. And we will also visually describe ourselves like Audrey and I just did and the images that we're looking at. And if you need additional live access support, you can message Roy, who's labeled Roy Tech. Hi, Roy. Thank you, Roy. And then just so everyone knows, a properly captioned recording is going to be uploaded on our YouTube for ongoing free access after this evening. And all sources and resources that we're going to talk about tonight will also be available on our website and sent out to everyone who registered as well. All right, next slide. So today we're going to do a little quick welcome that we're in the middle of right now. We're going to introduce our amazing guest speakers and then spend a big chunk of time asking them questions and learning from them up until the hour mark. Then we're going to take a little break, and then we'll get into action steps and resources and hopefully have a little bit of time for questions that we weren't able to answer during the panel. And then we'll wrap up. Let me go on. And just a little bit about our org. Probably most of you know, but for those of you who are maybe coming here through one of the speakers, we are a community-based nonprofit, and right now we're transitioning into providing direct clinical and alternative care services. So we're really in a transformative period, and we focus on supporting people with connective tissue variants and overlapping conditions. So that's a whole lot of conditions. We talk about what that includes a lot. And we do all of this with the cross-disability solidarity framework. It's really important to us. And since we launched, demand for our services has increased. We have 850% here on the slide. It may be more. Clearly, what we're doing meets a vital growing need for resources and accessible direct care. And we're working hard to make all that happen. And you can learn more at hyp+Access.org, hyp+Access.org. All right. Is this where you're going to take over, Audrey? Or was it a little further on? Do you recall?
Sure. Yes.
I can't remember. Go for it.
So the reason we're doing this panel is because the people that we serve really rely on healthcare to survive and maintain any semblance of quality of life, even though healthcare itself is, very violent. What our community experiences affects marginalized people more, and many rely 100% on public programs. And public programs are really the blueprint for all healthcare, even private, which I think a lot of people don't understand. We'll be talking about that today. And we know right now that healthcare is really under increased attack, and our communities are facing some really intense risk right now. And we should be prepared to mobilize around that. So that's what we're doing. You can go to the next slide, Elle. Thank you. So today we're hoping to provide enough information so folks just know a little bit more about kind of the history of the situation. We have two people here who have very complementary expertise in all of this. So we hope to fill some of that gap. And now I'm going to introduce today's speakers. Thank you, Elle, for keeping me on the flow. You can go to the next slide. So first, I'm going to introduce Luke Warren, who is a political director at National Committee to Preserve Social Security and Medicare. Luke is a political advocate in Washington, D.C., originally from New Jersey. He began his political career at George Washington University, focusing on healthcare policy and the Affordable Care Act. At the National Committee to Preserve Social Security and Medicare, Luke initially led grassroots efforts to protect seniors programs. Now serving as political director, he vets and endorses candidates who support seniors' benefits and advocates for stronger Social Security, Medicare, and Medicaid policies with Congress. And there's an image of Luke here. Luke, a white man with dark curly hair and a beard, wearing glasses and a suit, smiling into the camera. You can go to the next slide. Thank you, Luke, for being here. And now I will introduce Abby, also known as Babs, in quotations, Mahler. Abby is an independent media journalist and also is a part of Mask Bloc LA, has been very busy recently, and is always very busy, but has been very busy recently. Abby is an artist and activist born and raised on Tongva land, also known as Los Angeles. Their photography and work around clean air and other disability topics has been featured in the Sick Times, NPR, Death Panel, Mother Jones, Truth Out, Them, Conspirituality Podcast, and more. There's also an image of Babs here. Babs, a white femme person with long brown and blonde hair, faces the camera, leaning their elbow against a wall with their hand on their head. They're wearing black pants and a black tank top with a tan and brown embroidered belt, as well as a red well before KN95 with a gold and white mask chain that matches their white and gold glasses. Thank you, Babs, for being here as well. Okay, so now we're going to go into the panel, and Elle's going to stop sharing slides. So there's going to be a change in screen. And now I'm going to ask the first question to you both, which is really just, would you mind taking some time to introduce who you are and what you do for us? And I'll pass it to Babs to just make a decision. Does that sound okay? For who goes first? Or did you already have a plan?
You can go first.
Sure. Hi, my name is Babs. Yeah, part of Mask Bloc LA as well as a couple other local anti-COVID groups. And also sorry if the rain is very loud. This is a unusually rainy day here in LA. I have lupus, for which I take the drug hydroxychloroquine. That name may sound familiar. It was a heavily spectacularized medication in the early part of the COVID-19 pandemic, especially 2020 and through to about 2022. This was a medication that was heavily utilized by especially the radical right as a bit of snake oil to push the reopening of the economy. In trying to understand why I and at least 825,000 other lupus patients at least could not get our medication. Sincere apologies for notification sounds. I cannot mute them or I'll mute myself. In trying to understand why this happened to me and everybody in our community, I learned a lot about the folks, the actors who are taking power right now, the people who we are contending with, who are going to be making our policy. So that is why I am here to share.
Thank you so much, Abby. And Luke, would you mind giving an intro of who you are and what you do next?
Yeah, absolutely. So my name is Luke, and I want to thank Audrey and the entire organization for inviting me to be here today. I've learned a lot about the group, and it's really great work that you all are doing. So I'm the political director at the National Committee to Preserve Social Security and Medicare. I got into this line of work initially. I was in college and the Affordable Care Act, or Obamacare, was being passed, and just I kind of got sucked into all those debates around healthcare and just kind of had my mind blown over all the people fighting an expansion of Medicaid. And so trying to unravel that mystery got me down this path. And since then, I've been involved in liberal and progressive politics with a focus on healthcare and other safety net programs. Really, I'm just like a bleeding heart liberal, so that's why I'm here.
Cool. Thank you both so much. And now I'll hand it to you, Elle, to ask the next questions.
Great. Thank you all so much. So now we're gonna get into some background on the situation, have you both share knowledge you have of what's going on. So going straight back to you, Luke, in your own words, can you tell us what's going on right now? Provide some framing information, kind of a timeline of events, and what we do and don't know in relation to healthcare cuts.
Sure thing. And I may be coughing during this, so I apologize. I'm coming over a cold. But basically what's going on is nothing good. So right now there are really two main tracks that they're going to be attacking these programs that people rely on. There's the administrative track, which the Trump administration can do through their control of the agencies and then also through DOGE. And they can do those without Congress involvement. And then the second track is cuts to programs that people rely on in order to pay for tax cuts for billionaires. And that is what is working its way through Congress right now. So these two tracks, they can kind of intertwine and they affect each other. But most of my focus at the moment is on the current proposals working their way through Congress. You may all have seen last week, the House passed a budget resolution that included $880 billion in cuts to Medicaid. And so that's really the process that we are focusing on. So the background for it is in Trump's first term back in 2017, they passed a large trillion dollar tax cut that was overwhelmingly skewed for the wealthy and for big corporations. Because they used a procedure in the Senate to get it passed that allows it to pass with 51 votes that cannot be filibustered, it had to expire. If you use this procedure, they expire after a certain point. So this year, those tax cuts for rich people are expiring. And the main agenda that Republicans affirmatively want to do is maintain those tax cuts and then also expend them. However, they have to pay for them somehow. So that's where the cuts to Medicaid come in. And there are a bunch of different moving parts to this. And there's a Republican House and a Republican Senate, and the two sides have to come to an agreement on what the final outline will look like. But so the $880 billion in cuts that we saw passed last week, that was basically the first step to cutting the program. And the reason is because they offset $4.5 trillion in tax cuts with $2 trillion in spending cuts. And those are all programs that people rely on. So, even though the budget resolution that they passed last week didn't specifically mention Medicaid, there's nowhere else in the federal budget that they can get this money from. So they will go around saying, oh, well, nowhere in the resolution did it say we're cutting Medicaid. And that's really as bold of a lie or disingenuous as you can be, because there's just no other place for this money to come from. Not only that, but they have a long history of targeting these programs. After the Affordable Care Act came out, or Obamacare, they spent a decade trying to repeal it, as well as the Medicaid expansion that the Affordable Care Act oversaw. Millions of new people became eligible for Medicaid after the Affordable Care Act. So in Trump's first term, the first order of business was try to repeal that. And then when they failed that, then they went to cutting taxes. This time, they want to succeed in both of these things. So they're tying the tax cuts to the Medicaid cuts. And it's not just Medicaid cuts, it's also cuts to lots of other programs that people rely on. SNAP, people call it food stamp, education. There's going to be lots of devastating cuts to social service programs that people care about. And so they are still negotiating and talking to themselves what form of cuts will look like. And I can touch on what things we've heard about. But that's still all up in the air. And that's what we are monitoring and trying to put a stop to. And then on the DOGE side, it's just really administrative mismanagement to try to destroy the administrative state, to try and, on the one hand, break the government down to the point where they can then kind of grease the runway to privatize it. And then the other side, destroy benefits for people without ever having to do it through Congress. So that's where we're at today.
Thank you, Luke. Yeah. Interesting times we're living in, and so important for everyone to have this information. And I'm gonna pop it over to Abby now to provide some background from your perspective on this situation. So the question for you, Babs, is can you talk about what you've independently been reporting on and tracking over the past 5+ years? Who are the players and what is the game? Kind of why is this happening? And what are the things that you've observed?
Yeah, absolutely. So I just want to say I'm so grateful for the reporting of so many actual, like, trained reporters and scholars who inform the work that I've been doing. My topic, is quite narrowly in this arena, hydroxychloroquine shortages and kind of the impacts on disabled people. But in the process, I've learned a lot more about the wider ecosystem that lives in, which is where we're going to go. So. Uh, you can go all the way back to the 40s, the 60s. There are so many starting points that we could take, but I'm going to start in the 80s, which is when the Council for National Policy was formed. The Council for National Policy is a very secretive, though less so this week, and that's freaking me out, organization that the membership list is vast. They have very deep pockets, and they the membership of this group includes kind of all of the leadership of all of these groups that you have heard of. The Heritage Foundation, Alliance Defending Freedom. Oh, I should have a list in front of me, but it's all the baddies you know and hate. The Council for National Policy is not itself a, policy creation organization. It is a coordinating body, and their secrecy is to, kind of protect the way that these policies get created, to make it a little bit quieter, to make it seem like it is a bit more grassroots, but it is a coordinated effort by the radical right. Your Dobsons, your wives of Supreme Court justices, many people who participated in January 6th, etc. So the Council for National Policy and its members can be really traced to where we have ended up today. Many of them authored Project 2025, which is, it feels like trite to bring up at this moment, but they really are making some headway. Now, many of them hate Elon Musk is the thing, but they also really hated Donald Trump. The way that these kinds of folks square this, difficult circle and working with these kind of megalomaniacs is, uh, God's will requires a lot of means to an end, and these are very Christian, nationalist, Christian dominionist, Christian Zionist kind of folks. And the incredible book, the definitive text on the Council for National Policy, is Shadow Network by Ann Nelson. Shadow Network can walk you through how the Council for National Policy kind of swallowed its pride and helped elect Donald Trump the first time. These folks have, their end interests in mind, not us. And we are seeing it play out in all of the ways that Luke outlined, as well as in the choices for the agencies. Of course, RFK Jr. RFK Jr. Again, these people do not really like him at base. A lot of these folks actually do kind of want their children to thrive. So th these are devil's bargains that they're making. RFK Jr., as far as I know, is not a member of Council for National Policy, never has been. But Jay Bhattacharya spoke at a Council for National Policy meeting in 2022. Joseph Ladapo, who is kind of being tossed around for HSSCP, which I can't even remember what that stands for. It's Health and Human Services something or other. So many acronyms in this game. Joseph Ladapo is a member of America's Frontline Doctors, which is a medical extremist organization that did a lot of profiteering on my lupus medication, hydroxychloroquine, that was essentially spearheaded by the Council for National Policy via the Tea Party Patriots, the founder of whom is a member of the CNP. So it's a big web, big club. We're not in it. And they all have dovetailing desires, and that is why we are contending with what we're contending with. Also just want to in terms of policies that we were speaking of, Luke brought up some very tangible things. There's a tracker that I don't know if we want to bring up that can help you kind of keep track of what is going on Project 2025 wise. It's project 2025.observer, and you can dig through kind of all the ways that they show data. It's very interesting. Yeah, that's Anne's website down there. There's the Project 2025 Observer link in the chat. Other kind of tangible things that I can bring up. So, now that RFK Jr. is in charge, uh, his, he's in his position. He is in charge of vaccine court, which is a real thing. Vaccine court is where you go if you have an adverse impact from vaccinations, which I think many of us here know that can and will happen. All medications have side effects. And Vex Court is kind of where you would try and bring these concerns. He's also in charge of VAERS, which is the Vaccine Adverse Experiences Registry, I think. Am I making that up? As well as the Vaccine Safety System, and then the ACIP, which is the group that meets to discuss vaccine scheduling and which vaccine they're going to choose when. That meeting was already canceled. Hot take, I think it was better that he canceled it. I would much rather him not touch anything than break it all right now. So I know it's two bad choices. Neither are great. So then you think about FDA, the folks that we are installing over there, they're going to be looking at FDA's handling safety and foods recalls, medication safety. They're already Doge is looking at breaking the leases on buildings that keep track of medical safety. And then NIH, there's already been a lot of cutting from NIH by DOGE. Try to call it DOGE because it's very rude that he did what he did, and I hate it. So I will not honor him with respect. I hate Elon Musk. Gonna, documented Mother Jones. If things go kind of as previously planned at NIH, it would be more getting kind of grants money focused towards anti-vaxxers, towards medical disinformationists. But there may not even be any money anymore for that, which is also bad. Yeah, it's a weird time. The Project 2025 tracker is good, but it does not take into account any DOGE, malfeasance. So keep that in mind when you're looking at, whether or not preset goals are being achieved, because some of these goals require using money, but they don't want to use any money at DOGE. And so some of these goals may just not exist anymore because the money disappeared. Yeah, that I think is a pretty solid summary of the mess we're in.
Cool. Thank you, Babs. And I did drop those specific mentions in the chat, but we're also going to go through all those resources later and include all of these links and follow-up resources and public resources after the teach-in. So if you don't catch them now, don't worry. And now we're going to get into a pretty related question that you all have talked about a little. If Audrey, you want to take over.
Can you both speak to the legacy of these attacks that this situation grows out of and some of the repercussions maybe that we've seen happen in the past that, well, I'm kind of ad-libbing here, so if this is actually for a later question, I don't know. But yeah, like kind of connecting it to impact in a certain way based on what has happened in the past, if possible.
Sure. And these attacks that we've seen, as Babs mentioned, span for decades, and really the types of attacks we're seeing on these public programs. Ever since we've had a government that is actually, more than just collecting tariffs like back in the old days. Ever since the New Deal, you've had right-wingers trying to tear it down. The kind of modern attacks that we're seeing really grew out of the backlash to the civil rights movement. These programs tended to be more popular, and then once they became associated with, people I don't like are receiving them, that's when political ground gains to grow them. And so Medicaid has been a threat for that for a long time, because for a long time it has been perceived by a lot of the public and policymakers, as the program for, welfare queens. I'm speaking in quotes because, this is the racist propaganda that Ronald Reagan and them all were pushing against it. And so, these programs, the current cuts to Medicaid, one of the proposed proposed proposals is block granting the program. And they've done that to many other programs that have helped people. And, right now, Medicaid spending in the legal terms is mandatory, which means if, you are approved for it, you will get it. Block granting takes it, and all the federal money they're going to give a set amount. And the set amount is going to be a cut. And instead of just paying whatever services come, the block grant says this is the amount of money that the state has to spend on it. And we've seen them do that to programs, and they've successfully done it. And what happens is that's A, an immediate cut, and B, a long-term cut, because when spending is mandatory, it just happens regardless. But when it's discretionary and the Congress has to approve and reauthorize it every year, then you see it shrink. So there are just loads of programs over the years that were really valuable that have been block granted over time and then just kind of withered on the vine to die. And so the current proposals that they're looking to do to Medicaid would be an extension of that, and which, going back to 2017, they came one vote away from repealing the Affordable Care Act and also block granting Medicaid back in the day. I do want to stress, and we'll get to this, towards the end, I know, in the call to action, but like this isn't definitive yet, so we can still stop it. They have very small margins in Congress to pass this, which would be a huge, like, tearing up of American healthcare system. But that is the context for which it exists. There's just a long, sustained right-wing attack on these programs.
And I can kind of pick up that baton in terms of kind of what we've seen the last few years. The groundwork for the American population feeling any kind of way about the way that this is going was heavily laid in pretending COVID was over. COVID denial laid the groundwork for this moment. Getting a public, back to work, thereby kind of giving the idea that this was a safe choice to make was step one, taken by the Council for National Policy and allies. There's a lot that occurred in 2020 that went into kind of making this seem like a broadly held opinion. A lot of this kind of was seated in churches. Surprise, surprise. But the reality is, many people do not like doing things that prevent disease of all political persuasions. And so once permission was essentially given by Joe Biden, tacitly or explicitly, regarding acting as if there was no longer a threat from the novel coronavirus, people took that and ran, took their masks off, began gathering as though repeated infections that they were getting from these, behaving as if it were 2019, were nothing to worry about. There is no literature that shows that that's the case. There's plenty of literature that shows these repeated infections are contributing, in addition to the anti-vax sentiment that has been seeded by the right for the better part of the last 40 years, is contributing to the resurgence of many, diseases thought to be a thing of the past. Obviously, not all of these things were wiped out by vaccination, but some of them were, in many ways, considered eradicated and are now returning. There is harm to the immune system done by SARS-CoV-2, and so even folks who otherwise cared to be vaccinated are still experiencing the side effects from continued infection and others making the choice not to vaccinate. Further, there was just continuous policy decisions during the Biden administration that set us up for this. So this is not just a right-wing plot. It has also been enabled by Democrats, by independents. This place that we are in was built by all parties. I think we can leave it there.
Well, Babs, I actually want to add a thing. So, and also this mirrors the flu pandemic in 1918,
18.
right? And then kind of the way that everything happened there is a similar utilizing a pandemic, really normalizing it, to impart a certain level of ableism towards specific populations, to strip people of rights, to push people further out of being resourced. So we're kind of in a repeat situation. L, right?
Yes. Yes, it is me. So now I'm gonna ask Luke, you to go first, to talk about what is potentially to come. I know it's hard to predict with all of the unknowns kind of ongoing. So amidst those unknowns, from your knowledge base, what do you think Medicaid and Medicare patients can potentially expect in the coming years? Kind of what are the risks? What are the things?
Sure. And that also can be answered by talking about the two tracks I was talking about. There's the legislative and then the Doge track. Legislatively, I've talked about how they're looking at block granting the program. They won't say what they're actually going to be doing, but we know that they're going to be trying to cut, billions of dollars from Medicaid. As I mentioned, block granting would be just really eliminating the individual's right to health care, and it would make it subject to a state budget and, put themselves on the line. Another proposal that has a lot of legs that I think probably is very likely to go through, maybe more likely than some of the others, is work requirements. And these are obviously, they are something that pull well, because if you say, oh, well, make people who receive these programs, they should work. That pulls well, so they have a bit more political coverage for it. But these are really just about creating red tape, which disenroll people from these programs. During the last Trump administration, there were two states that experimented with work requirements. One of them, eventually the courts ruled against it, and because it had no impact on employment, but just disenrolled a lot of people who should have been enrolled on Medicaid. And then, just in terms of creating red tape and barriers, if we do get into a situation where Medicaid is cut by this amount, it would be, a lot of people were disenrolled during when the expanded Medicaid during the pandemic expired. And basically that on steroids would be your experience, because I've heard also, right now it's a yearly enrollment. I've heard of a proposal to make it twice yearly. So that would just kick people off with red tape, and also just with malicious administrators. So people who are trying deliberately to get as many people kicked off as possible. And then on the other side, the Doge side, this part is, very hypothetical, but it's scary. But, basically look and see if you're following the news and seeing how, business gets done now that Trump's back in office. We're seeing people contributing millions of dollars or buying millions of dollars of his meme coin and then having SEC investigations into them dropped. It's a real pay to play going on right now, and they're trying to flood out by destroying these agencies and getting the career civil servants either fired or just so demoralized that they quit, and they're trying to put in loyalists only. And then loyalists only who will have great discretion in how these programs are run and how agencies function and how investigations are handled and how monies get spent. So, down the line, it's not, if they are successful in doing what they want to do to Medicaid and ending the guarantee that people have to it, you could be in a situation where some Doge kid is in charge of which providers get Medicaid dollars, and I don't think that this clinic would be one that'd be favored by a bunch of MAGA people. And even going further, it's easy to imagine a scenario where individual coverage for individuals gets chosen based on, how MAGA you are and based on, any characteristics you might have that they might not like. So really just destroying democratic governance as we see it through like the administrative state of, governance and how these authorities conduct themselves, and really just filling it with malicious intent. So that is absolutely a threat that we could be facing down.
Thanks for breaking that down, Luke. And now, Abby, if you could add from your perspective what you think folks who, rely on healthcare to survive should expect, things that maybe they should be doing to prepare.
Yeah, I mean, you can only do so much. And I
True.
definitely know this is somebody who takes stimulants. This has been a rough couple of years for those of us who do rely on stimulants, unfortunately. So if you've been following that, it's kind of a precursor to what we might expect. The hydroxychloroquine shortage was, I think, it, very unique in the way that it unfolded, and it's not out of the question for something like that to happen again. But I do think that a better example for something that you might expect to happen is something like Adderall, where everybody's pointing fingers at each other, oh, it's the fault of the DEA because they're not approving enough places, enough manufacturers to get their allotted amount of ephedrine, or it's actually on the FDA for not giving more like vouchers because you have to like fill out something to like become a producer of stimulants, and it's just a lot of back and forth bureaucracy that leads to there being no pills. um, this could easily happen again for this medication or something similar to others. There's also the very likely reality that places that produce these shut down or we are not able to access them. A lot of these drugs, especially generics, are made overseas in places like India, Pakistan, a couple other countries, Cambodia. Um, these factories are already, I hate to say, a bit questionable in terms of their cleanliness practices. There's a book on this by Catherine Eban called Bottle of Lies. They're just not inspected as often as, the law says that they're supposed to be, and this can lead to issues not only in the manufacturing, but also, they're not packed well enough to ship across the ocean, and, heat gets to them. Like, there are just so many factors that once we start removing all of these safeguards in place, we start firing people. There are so many places where things can break and make it so, the medication that you rely on, or, even there's another example in terms of climate change that all of the saline manufacturers, had to close due to one of the recent hurricanes. Can't even remember which at this point. That there are going to be bottlenecks. I just think the reality is you have to prepare for the unexpected, prepare to not be able to get your thing, and have kind of a plan in place for what that might look like. Because if you're in a situation where, stimulants you can only get a month at a time, that's it. There's just no other choice. So, what can you do? Can you take it every other day? Can you split your pills? Can you find something over the counter that does just good enough? Any of those possibilities just to have on hand. Not the worst idea. But the reality is, something wild could happen, like your medication becoming a political football. And in that case, there is no way you can prepare. Like the fact that I did not miss a dose in March of 2020 was a total fluke. I had gotten extra medication to travel in January, and I had extra. I also was able to access medication for 4 times higher of a price because my family had the money. So there are going to be these shitty situations where you are looking at paying 4, 6. I almost had to pay 7 times more for hydroxychloroquine in 2020 if something truly out of left field happens. Expect the unexpected is the best advice, frankly, I can give, because even in my wildest dreams, I could never have come up with a story like what happened to hydroxychloroquine, and yet it happened. So there are banal realities that kind of happen in bureaucracies, and there are wild stories that happen every single day.
Thank you. Yeah, definitely. And we have some specific resources for kind of medication rationing and things like that coming later on. And now, Audrey, if you want to transition us into advocacy.
Sure. So if only we knew the answer to this question, but from both of your perspectives at this point in time, what advocacy efforts have the biggest chance of making a difference? Is there legislation that could be focused on to improve access to care? That's kind of that's a long-term goal. Um, and if there's any strategy, and if it's coming from anyone in particular that seems good to get behind, you want to touch on grassroots at all? Yeah, whatever you think.
Yeah, I think it's very easy to be like cynical, and there's good reason to be cynical about, anything involving the government. But really, like, it really does matter when you're lobbying Congress people on a bill like this. I'm talking about the Medicaid cut and tax cut. Um, you know, in 2017, I mentioned that it came one vote away from already doing what we're talking about. And there was just a grassroots uprising, and just these members of Congress that were voting on this thing, they were hounded every single where they went. And that was successful, right? Like the uprising and the grassroots and the people sharing their stories, like that mattered. So we have a bunch of resources down below. And, I think that it's easy to look at what they're talking about doing to Medicaid because it's so dangerous and so damaging. I don't think that these guys realize how important Medicaid is because they have the racist perception that, oh, like it's just poor people's program. I think that they think that they could just screw over poor people in a black hole, and they'd be happy to do that all day. Like that's why they're, conservatives. It's real. They don't understand that the money Medicaid goes into keeps hospitals, keeps jobs, keeps entire communities together. And it's just to the cuts of the magnitude that they're talking about doing, they're playing with a loaded gun and they don't even realize it.
Can I speak to one other thing that you just brought up in my mind that because hospitals rely on so much of this money, if that just goes, say it's a DOGE kind of situation and it's just gone, whatever that means, uh, that hospitals are very likely to be bought by private equity if they are saved at all. So we are very likely to see even fewer points of care. So I think that's another thing to prepare for is just lack of access to actual infrastructure.
That's a great point. And even just staffing, hospitals just like that are basically doors open and not much. So really, and if ever there's a time to like, chain yourself to the door, like this is it. I would say it's one thing to like, call and write and share your stories and make sure people hear and are aware about this. But really, if you can and are able to like get there in person to do it, that matters. And if you know anyone in any of these districts that are, swing districts, I know we're in New York and there are a bunch of, New York Republicans in the House who voted to gut Medicaid, even though New Yorkers benefit from Medicaid more than, most people in other states. So really, really just try to give them as much hell as you can because like once it's gone, it's really not coming back. I mean, we've seen this with other programs that they've block granted and cut. I mean, higher education used to be like very attainable until they just stripped it away. Like all these public services, once they go down that path, it's really hard to get them back.
And I want to add a thing about hospital systems that I don't think people really know because I think the people who run hospital systems don't want to admit how much they actually rely on Medicaid to function. But the average profit margin for hospitals in the US is currently 1.2%, which is nothing. And their highest payer actually is often Medicaid. It's not commercial insurers. So the way that that happens is they get big donors to put money into building new spaces. And the more money they put into building new spaces, the state and by way of the federal government essentially then has a math problem that nobody understands where they then increase their Medicaid reimbursement rate for that hospital. So that's why they put 200 million into a space and then for Medicaid they will pay $3,000 for a saline infusion. So when we're talking about that 1.2% profit margin, $3,000 for saline compared to a commercial insurer paying $148, which is the base rate that Medicare and Medicaid actually set for the nation. You know, when Medicaid is gutted and block granted, like these hospitals will crumble. Like this is actually their main source of quote unquote profit. Of course, there's probably a big conversation we could have about where does the money they're profiting go? Because a lot of them are nonprofits, so they're just going to redistribute it, which is why we then get CEOs in nonprofits making $12 million a year. So it's not that there isn't only 1.2% profit, but that profit is coming from Medicaid. Um,
And that's I kind of building off that. They want to move very quickly with this, basically because the longer that this process plays out, the more opposition can build to it. Um, when they passed the Affordable Care Act, those deliberations were so public, and it took a year, and it was just hell. And then they finally passed it, and then it was so unpopular by the time they finally did. And then, of course, that changed over time. But so they are really trying to move very quickly. And really, it's a math problem in the House. I'm talking about like, numbers a lot and, the members of Congress, because it really does come down to nothing. They have, you know, a 5-seat majority at the best, but there's currently vacancies. They want to pass another resolution by April because there are 2 special elections in Florida that were going to give them solid Republicans. So they're holding off just to get an extra 2 votes, basically, because that's how worried they are about the numbers that they have to pass it. So it's going to be moving quickly just in terms of timeline. But I anticipate these things always take a little bit longer than they anticipate. I heard Mike Johnson say he wants to have a bill for Trump to sign by Memorial Day. I think that timeline is very, very optimistic. But keep your eye on events and follow the news, and just basically yell at them the entire time for like the next until it passes or doesn't.
And speed is an excellent point. There was a gal who won the Nobel Peace Prize, whose name is escaping me, even though I have her book on hold at the library, who lived through, I think it was Duterte's administration. And what she was astounded by is the speed that we are enduring. It is the same playbook that Elon played out at Twitter. So this probably wouldn't have taken the amount of time it has if Elon had not come in and just taken all of the money. So know that this is not going, even as the like CNP careful architects that they are liked to imagine it. This is going very, very quickly. And so any way that you have to be a wrench in whatever is going on, do it.
Is that Maria Ressa that you're referring to?
That is exactly what I'm
Gotcha. Great. Speaking of what folks can do, can the 2 of you now speak to kind of what you're directly involved in, what specific efforts you or orgs that you're part of are trying to spearhead, and how folks can maybe help?
I go first for this one. So I really turned my attention to local in the past couple of years. For a bit, after the initial wave of hydroxychloroquine shortages, I was trying to do literally anything to make that harder to do again. And the tact that myself and the group that I was working with took was trying to kind of, get medical boards to step up and do something about doctors who are spreading this and disinformation. Went nowhere. In fact, things are getting worse. There are laws in like just about every state, most states, that are looking to, in other, in so many ways, allow prescriptions of hydroxychloroquine and ivermectin to be gotten more easily. So even the things that we tried to do to put stopgaps in place did not really take, and was threatened with litigation because these people have a lot of money and nothing but time. So unless you feel like you have a really solid network, more power to you in terms of going big. What seems very realistic to me, as somebody who does not have Stephen Biss lawyer money, is building these local networks so that when collapse does happen in whatever way, it manifests, we have networks to fall back on. This was very true in the last couple of months here in LA. When the fires broke out, Mask Bloc LA distributed over 300,000 masks, and in all free, next to no time at all. We're just normal people, not even 501(c)(3), nothing. You can do big things. It just requires some trust in people that you are in touch with. These are people that you might not always agree in every way on, and that's okay. You agree on enough, especially if you agree that this sucks and we should all be alive. Sometimes that's all it takes to be able to work well with others in your community. I think being aware of what mutual aid networks in your city can provide for you, like in LA, we now have multiple mask storages being covered by LA Mutual Aid Network. Like I no clue that that existed, but now we have 6 months of storage. So like being in touch with people, saying yes to things, saying yes to your precious time, going somewhere that you might not otherwise put it can mean a lot of big things coming in your direction. There's a lot of resources to be had. In our case, say a lot of masks just sitting in warehouses that we were able to access and are now sitting in our storage, ready to go out to, especially we're looking at folks in the Central Valley who are going to likely be contending with who already are, but are contending with bird flu much more readily than we are in the city, for the moment. So being able to build these networks of getting people what they need for as little as you possibly can. If it's not free, then maybe it's free 99. And doing whatever you can to at least know like when something is needed, you've got someone to call that's near you. That is more than a lot of people can say, and that will take you further than you may expect. So I say building local and making sure that you at least have a conception of how bad it could get so that you are prepared if it ever does get that bad. And hey, if not, pleasant surprise. We love that.
Oh yeah.
Well, that's great. And, I agree so much about all the local community stuff. Um, from my work in my organization and my kind of partner groups in the nonprofit political world, you know, we're doing both legislative advocacy, just trying to stop this bill, and educating our allies in Congress who maybe don't know about these information, about the threats out there to them, and then just talking to our members. And my group is a membership organization, so we just try to keep them informed and keep people up to date and engaged and aware that their voices can make a difference in stopping this monstrous bill. And that's one thing. Some of our allies in Congress, they have a form that you can fill out. They're looking for stories about people who are on Medicaid and how Medicaid is important to them. And they are looking for real people with real stories because those are always good to highlight, and those can help make the difference and help put a human face on these kind of abstract, boring policy debates.
And Luke,
Thank you. And I'm putting that in the chat. Sorry, Audrey, go ahead.
I was just going to ask if people could fill out the form if they have ever been on Medicaid before. Does it need to be they're currently on Medicaid, or could it be a story?
I think you can, yeah. Uh, I think so. Yeah, I'll fill out the form anyway, I would say, if you have. The more stories, the better. They're always looking for real people, which is, it seems like it'd be a very easy thing to do, but it's always surprisingly hard.
Yes. Well, people have complicated lives, dealing
Yeah.
with many things. Um, so yeah, we will definitely pass this form around. It'll also be in our resources and in our slides. And if folks have the time, it's a pretty simple form. And we'll also be sending out an email for folks who want to fill the form out just through email instead of through the form if the form isn't accessible, but we're not sharing it publicly right now because this recording will be up on YouTube. So yeah, you will get access to an alternative way to fill out the form if you need.
Just wanted to say
Yeah.
one more thing. Something that I also want to encourage people is bringing the ideas of disability justice into whatever group you're already in, especially when it comes to the very easy action that is wearing a mask. Clean air is unfortunately just like so relevant. I am so tired of talking about it. I can't emphasize enough. But if you are able to even get, your local DSA to wear a mask this meeting to be a mask required kind of meeting, then that is going to be a game changer for the people who are allowed to participate. And it will be even safer for those who are unable to wear a mask. The reality is that we are in a situation where there is likely nothing to stop us from getting sicker and sicker. And so anything that you can do to stop you and your comrades from getting more disabled now is something that you should put high on your priority list. Learning how to talk about it in a way that appeals to people who do not want to hear about it, because the glaze face that I feel like many of us get when this topic comes up from folks, where it's, well, I'm getting sick all the time. I just don't understand what's going on. Well, it's like, well, did you wear a mask on your flight? Like, there is just like nothing behind the eyes in a lot of time, conversations. Learning how to talk about this in a way that kind of pushes past that is something that I heavily encourage people. If you are a talker, if you are the kind of person who is building bridges, like this is something worth your time, because if we just all keep getting sicker, it's going to be way harder to do literally anything.
And a lot of the conditions that people are developing post-viral infection are the ones we all know very intimately, and we already know that there isn't really healthcare for. And so,
Talk about connective tissue.
I know. And then without Medicaid, boom, I mean, it becomes a whole other spiral.
Yeah, there are folks in the chat affirming the importance of clean air. Adam saying that it's a luxury many of us are denied, or more accurately, a right. And Ellie's saying yes to clean air and taking care of each other. Masking is such a simple, though not always easy, for those of us with disabilities, way to care for each other. Thanks everyone for bringing that in. And we are running a little late, but our last question here is a little more of a maybe dreamy question, if we're really looking at the situation we find ourselves in now. But if the two of you were to think about what really would make healthcare good, what needs to change about healthcare now, what policy efforts need to happen so sick, disabled, and marginalized folks are actually cared for, what would you say?
Well, I think we have a bunch of good programs that exist now, like Medicare, Medicaid, even just all sorts of programs. But they're not coordinated and they're all very atomized. I think it'd be great if we could just coordinate them somehow. But really, outside of just like, little tinkering around these programs, just I think the incentives are all wrong, and just some way to fix the incentives so that, we spend more money than anyone else and we have worse health outcomes than anyone else. And so really getting to the root of that problem. But yeah, I don't think anything is happening on the federal level that's going to be good anytime soon. So really look inward and locally and try to, uh, create space and hold on to what you can have.
Absolutely. Babs, any thoughts to add?
I think whatever I will say will dovetail so well with what we're about to talk about that I will simply hand the mic over.
Okay. Amazing. Thank you both so much. And later on, we're going to have just a little bit of time for questions. But right now, we're going to take a little break and then come back and get into action, tools, resources, advocacy. And we'll probably, my guess would be, run about 10 to 15 minutes over the half-hour mark for ending the event. But right now, let's take 5 and come back at 15 after. And I'm going to pause the recording and we'll be back with resources. All right, we are back from our break and we're gonna get into resources for advocacy, how to protect yourself, et cetera, et cetera. I'm gonna start sharing my screen again. And I will also repeat that all of this stuff will be shared out and publicly available after this evening. All right, I am sharing. And we are back on a gradient purple to pink slide, talking about what we can do to protect ourselves and each other within these systems that we currently have. I'm going to go to the next slide. So the first thing that we've already talked about some is contacting those reps. This is direct advocacy, and we've been mainly speaking about Medicaid tonight. We're going to share out 2 action tools. One is a multi-page explainer with action tools from Dredf, and one is like a very simple 1-page form if you find the other one a little too overwhelming for, repeatedly contacting your reps about saying no to Medicaid cuts. We also have a tool here for telehealth, which we haven't talked about much this evening, but is also under attack. And we have a link for fighting back against that. And we also have one here for protecting Section 504, which is very baseline disability discrimination protection that is also under attack right now. There's kind of a big lawsuit going on, and you can learn more about that through this link via DREP and through a lot of other disability-based organizations that we're going to have later in this section.
Can I say something about telehealth, Al, really quick?
Please. Yeah.
So telehealth is basically up for renewal as a service that is paid at the same rate as an in-person, what is called an E&M or a doctor's visit. And telehealth wasn't really used as a service prior to the COVID pandemic because it was paid at such a lower rate compared to an in-person visit, even though a lot of the time it would require the doctor to actually be at the center still which anyway, there's a lot to say about how they design things. But so if this doesn't get renewed, this is specifically Medicare, but Medicare actually sets all of the payment rates for all insurance types, including Medicaid. Medicaid will generally be a little lower unless, you get that big reimbursement because you put a bunch of money into your hospital system from a donor. And that means that if Medicare decides not to continue to pay telehealth at the same rate as an in-person E&M, that commercial insurance types will also follow that. So this is not just for people on Medicare. This is like eliminating telehealth as a service entirely because it would not cover costs anymore for providers to utilize that. Okay.
Thank you. All right, and next slide. This is just a repeat of the information from Luke. So a specific thing that we'll share out is this form to provide testimonials. The staff on the House Energy and Commerce Committee are asking for these, why Medicaid is important to you, how cuts would hurt you. And I looked into the form, and it looks like it's also for, caregivers for organizations. So I think if you've been on Medicaid before, it's totally viable to submit some information there. So that is in the chat, and it will also be in the YouTube description for folks watching this in the future. And we're repeating that a private email contact for if this form is inaccessible to you will be shared in follow-up email. And if you're watching this on YouTube, you can contact us to be put in touch. All right. And now, Audrey, could you take us through some of these community recommendations?
Yeah. So first we have to say this is not medical advice. Don't assume you'll have access to your meds for the next 4 years. So one of the ways that people are talking about creating some kind of cushion for medication is go to your physicians, which means you have to pay to go see your physician, right? So there's that. But you don't have to pay your medical bills sometimes if you can't, you know what I mean? So I don't know. But say that you're leaving the country on an extended vacation, you need a 90-day supply. You shouldn't do this in writing. Apparently, it should really be verbally, just so you actually get it. Um, if you are on, this is another thing that's not written down, but if you're prescribed medications that maybe are as needed and you don't use them as often, you could also request some of those prescriptions to be filled at a quicker rate than you might even need them. Especially for medications that are really expensive out of pocket. If you have a really nice insurance type that makes that copay really great and you don't use it as often, that's really something to consider. There are resources on safely going off medications in the event that you no longer have access and you need to taper. And this is stuff that you should figure out now so that if you do need to taper, you know what that is and you know when you need to start tapering, because there are a lot of medications that, even antihistamines, we're learning a lot more about their different impacts long term and how negative they can be. And you should be tapering off all of your meds, probably even if doctors say you don't need to, especially if you've been on them for a long time.
Yeah, we'll say that for whatever difficulties the Adderall shortages had caused me, I'm glad that I know what a taper feels like already going into this future. So if you have the ability to safely just like give it a whirl, while you still have some to go back on, so you know what it feels like what is and isn't okay, that will be knowledge it'll be good to have in the future where it might not be available, unfortunately. Again, not medical advice. Don't do this if you think that it'll be bad for you. Please don't.
Um, Now might be a time to pursue other forms of care like traditional Chinese medicine, herbalism, or other alternative practices. If you have an opportunity to establish new routes of care that hopefully won't be as impacted in terms of just supply chain as medical care. I think we're also going to see a lot of claims coming out about things curing things, and we don't know if they're going to be third-party lab tested, and we don't really know where they're going to be coming from. So that's another conversation. But for some things, considering establishing that route of care might be something to
And
consider.
something to think about in terms of like things that may not be impacted by supply chain. There are unexpected things in those just like jars that somebody might order from China. Like it's like all the way down to packaging. There are going to be so many points of possible failure.
Yes, especially in relation to things needing to be sterile. Like there are not very many places that make things in a sterile environment, and so once those get knocked out, you just don't have them. Um, we talked about this a moment ago, but there's probably going to be further supplement deregulation and, just a deregulation around third-party lab testing requirements and just general reporting requirements. Not that there's that many reporting requirements now. So there will be definitely bold claims of cures on the horizon and probably people pushing a lot of supplements in different ways as alternatives. I think we all already experienced that enough and kind of know how to, delineate. But yes, that will probably take over pharma in a lot of ways, especially if certain things are gutted.
And I'll actually interject to bring it back to Abby, your local recommendations. I feel like alongside this, getting to know local herbalists, people who are growing their own plants, people who are kind of in these worlds is really
Compounding
important
pharmacists
for,
even.
yes, yes. So you're not just completely on your own with things, but you have more actual person-to-person connections.
If we have a moment for one slight interjection, since we okay, so just be skeptical, especially in this area of these third party folks, knowing who is likely coming into power at the FDA. Even our long COVID is kind of guilty of this. The subreddit, the original long COVID subreddit. Now many people go to COVID long haulers in part because of what I'm about to say, that r/long COVID took like a brand promotion deal with the wellness company, which is a RFK Jr. quack affiliated website. The kinds of people that profiteer on my lupus medication, ivermectin, this got all the way back to long COVID folks because people with chronic illness, I count that as I do not have long COVID. People with chronic illnesses are looking for anything that we could possibly use. So even your comrades, be skeptical. Always check out these websites for yourself. Make sure you know who is selling you what, where it is coming from. If you have the spoons, ask for
Absolutely.
to help you too.
Yeah, building trust is not easy, but starting now is really important.
Yeah, and we have a point in the chat that is also very complimentary. Lizzie says, and healthcare workers broadly. I mean, be careful, obviously, but there are comrades among the healthcare workers out there, even physicians. And this is true. And veterinarians, sometimes the pets get a lot better care access to things, and we find crossovers. Not to say that that's how, but And our last point on this slide is don't assume that your commercial insurance will continue to cover everything you have access to now, because the Center for Medicaid and Medicare is the rulemaker for everyone. And the commercial insurance doesn't want to pay for things that the federal government doesn't regulate, because then they don't have to pay for that, So all of these changes that are happening are going to impact everyone in every situation in relation to healthcare. You can go to the next slide, Al. If you have the spoons, going to doctors now, getting things charted, getting access to your records, requesting them, getting screenings or treatments done. Systems are just going to become more bogged down. Staffing ratios are going to get worse. The time allotted is going to be lower. I think New York City Health and Hospital Systems just announced they're implementing 10-minute E&M time restrictions, which is wild. So premiums are also absolutely going to go up, and so will hospital bills. If Medicaid is not funding that extra amount for these hospital systems, that is going to be placed on the patient at whatever insurance tier you are in. And again, you don't have to pay your medical bills if you can't. So, utilize charity care programs for bills while they still exist. If you can just get them down a little bit, you don't have to pay your bills. And know that it's likely that cuts to CMS coverage and reimbursement will really disable the healthcare system and really make it crumble. We talked about costs going up, being transferred to patients. Programs are also going to be cut due to low profit margins and kind of inability to balance them through other services. Hospital staffing will get more unsafe, and hospital workers are going to leave. We've already seen a mass exodus of hospital workers happening and continuing to happen because they don't like the environment they're working in either. They're not supported. And Babs put something in. Yes, this is a great resource. It's called $4.org, and it is for a nonprofit that works to provide charity care help, and they eliminate a lot of medical bills. So yes, thank you. We can go to the next slide.
Select all those for resources.
Yeah.
And I can jump back in here, Audrey. So here we have a list of a lot of different resources, places that you can get more accurate public health information as that becomes or is likely to become less and less reliable from the government. And again, these links will be shared out. We've got KFF Health, Stat News, 2 different journalists with Mother Jones right now, Julia Mitro and Anna Merlin. I'm not sure I'm saying Anna's name correctly. That's a recommendation from Babs. Thank you for that. And another rec from Babs is Elizabeth Bick, who is a science integrity consultant. We've got a link to the Blue Sky and to the blog. So it's another place where you can kind of keep up with the integrity of science. And we've also got the People's CDC, which folks have probably heard of, kind of doing the work of the CDC for the people. as well as the sick times. And another resource or recommendation that has been made and that we stand by is to check out Canada's public health resources, as ours may become kind of not resources. An example would be their vaccine schedules, if that becomes not a thing that our government provides. And then we've also got that Project 2025 tracker here. And the link that we're going to be sharing out is set to the CDC as a filter, but there are a lot of different ways that you can use that, just not for DOGE, as you said earlier, Babs. And thanks for that tracker. And then finally on this slide, we've got some resource guides, and we might kind of add in some of the other resources that have been mentioned in the chat to this list that we share out after the fact. We've got a self-advocate's guide to Medicaid, which provides advocacy resources as well as kind of a basic understanding of Medicaid as a program. And then we've got a breakdown, some of which the information was covered on the slides we just went through, but a more complete version of kind of things you can do if you're worried about losing access to medications. And this resource is specifically geared towards psychiatric medications. This is really great work by Project Let's. And we want to let you know that the image descriptions for that slide deck on Instagram are in the comments there if you need those for access. Did something just come up in the chat?
Yes, there is a comment. Hector added another resource that we will add to our links list. The WHO also publishes health information and recommendations. Thank you, Hector.
True. Great. Right. And now we have some additional learning from Babs. And I don't know if you want to interject to say anything about these, but I'm just kind of gonna roll through them. We've got kind of two categories, a general and health category and a Christian nationalism category for learning more about how that has informed this situation. So first up, we've got An Arm and a Leg, a podcast about healthcare costs. We've also got a specific author and scholar on authoritarianism called Sarah Kendzior, I believe.
Yeah.
And then a book on the anti-vax movement by Jonathan Howard, We Want Them Infected. And then for the Christian nationalism resources, we've got the work of Ann Nelson, who wrote the Shadow Network book that Babs referenced earlier, as well as a religious scholar, Bradley Onishi, and different podcasts that person has worked on.
Yeah, I definitely, when it comes to the Christian nationalism angle, it may not seem direct at first, but it is these connections go very far back. I think reading Shadow Network will affect the way that you interact with politics in general. You will start to notice all of the places that they should be mentioned, and they just aren't. Brad Onishi will mention them a lot. Brad Onishi and Ann Nelson know each other, very much benefit from each other's work. And The Orange Wave is the only paid podcast on here. I paid the $20 and I don't regret it in the slightest. It's a very, very good podcast. Really tracks the rise of the radical right, especially in Southern California. So if you are a Southern Californian like myself, that might just be an interesting history of your area that you might have missed. Charismatic Revival Fury really focuses on the New Apostolic Reformation and names you may be starting to get more familiar with, really kind of folks that are informing the Trump administration's theology. And Straight White American Jesus is kind of like the umbrella, like that's like Brad and his co-hosts like go-to podcast feed. I'm a little behind on almost everything right now, and I will say that any of my podcast recommendations come with the asterisk that almost all of these people are still doing pandemic denial. Pretty sure they're, oh, I can't believe I'm sick again kind of vibe. So like, prepare thyself for that to be, part of it.
Thanks. All right, going to the next slide. We have a big list of organizations here. And if you're kind of feeling starved as well for places to keep up with news or keep up with disability advocacy, a lot of these places are really good tools. Again, this also comes with a caveat similar to the one Babs just gave. We're like they may not be entirely aligned with the values that you share, especially if you're in disability justice organizing. They may be more disability rights focused. They may have other issues with them, but they also may be a really great center for various information and advocacy efforts. So first up, we've got a really beloved, amazing organization, New Disabled South, and you can find information on Medicaid cuts and 504, all these things that are happening right now. We've got the Disability Rights Ed and Education Fund, DREDF, and they're really kind of leading the charge on a lot of Medicaid and 504 advocacy right now. We've also got Senior and Disability Action, which is a really cool group that we encourage you to check out. And then we've got Caring Across Generations, that is also doing a lot of Medicaid work right now. We've got the Hand in Hand Domestic Employers Network, which is kind of connecting these issues to care workers, to home care workers, and kind of labor rights. And we've also got the Healthcare Education Project. You may be seeing their ads a lot lately for Medicaid cuts. They're really working hard to get the word out. We've also got the Autistic Self-Advocacy Network that's doing lots of kind of plain language resource work for Medicaid and other issues happening right now. We've also got the Alliance for Connected Care, which is one of the only organizations in this list that is focusing quite a bit on telehealth access. And then we've got two additions from Luke, Families USA, which is a kind of healthcare consumer rights organization, and Justice in Aging, which according to their tagline, fights senior poverty through the law. Thanks, Luke, for those recommendations. And again, you'll get all these links. Any additions or thoughts from anyone? Cool. I'm going to move on and see what I put on the next slide. Oh, we're going to talk about Hyp+Care just a little bit. So this teach-in, again, this panel is part of an ongoing series, and we are still building new healthcare infrastructure, despite the fact that this is all going on, because what else would we do? People need care, and we need much better systems than we have now. So all this work is still ongoing, and we have a campaign you can check out. It is really appreciated for you to share our work with your friends, your family, your networks, get the word out about this situation that is happening right now, as well as what we and different orgs are trying to do about it. You can become a team fundraising member on GiveButter if you want. And you can also sign up for a clinic waitlist, which helps us track the healthcare needs that folks have and design solutions to meet those and kind of figure out with policy and with the different things we're dealing with what is most possible. Anything you want to add there, Audrey, before we have a little Q&A time?
We're opening a clinic that takes.
If that wasn't clear. Yes.
We're doing in New York City. So
yeah. And next slide, I think there's a QR code. Sorry, Audrey.
Someone put something in the chat that I'm going to read. B asked, will all these resources be shared after? Thanks so much for organizing this. Yes, so we're going to send an email out to all participants with all of these pieces of information. So it may be a little bit of an overwhelming amount, but you will have access. And we can go to the next slide.
This is just for anyone who wants to check out the campaign. And we've got some beautiful graphics of pill-shaped flowers rolling across the screen. And you can scan the QR code if you need. But we'll also share out all these links with the resources. I'm going to stop my share now. Okay.
And before 40 past the hour, thank you so much to Babs and Luke for coming and talking about all of these things and sharing really all the work that you both have been doing for many, many years. And it's really culminating right now in a really unfortunate pinnacle, but it's really important that we connect with folks like you to learn about how these things happen and what we can expect so that we can prepare. We definitely want to be realistic about reality. you know, we want to stay here. So, yeah, thank you both so much. And thank you for everyone attending live and in the future. Anything else you want to say, Elle or Babs or Luke or anyone? Got some thank yous in the chat. Thank you, Jolie and Lizzie and Simone.
Yeah, thank you guys for being interested. Oh my God, I wish I was wrong about this. I wish I could shut up. I wish like this was not where we were. So I'm always grateful for people who are like ready to listen and think to a different time, you know.
For sure.
Yeah. And thank you again for inviting us. And this has been a really great conversation. I've really enjoyed hearing everything everyone's had to say. And Hyp+Access is such a great organization. So thank you for the work you're doing. Um, and also just, yeah, I do want to stress again, and Audrey, we've talked about this when we talked about like the scale of the cuts that they're talking about, how just hard it is to imagine because they're so devastating and they'd be so awful. But a lot of devastating and awful things that had seemed unimaginable have happened in our lifetime. So that doesn't mean that they won't happen. But it's going to be really tough for them to get it done. So really, please, please just try to get out there and do something. That's really the only thing that can stop it at this point, is flipping a few votes in the House to stop this. And then, at least protect Medicaid for now. There are all the other threats that we've talked about tonight, which, well, we'll have to turn the community to do. But, legislatively, the $880 billion, it can be stopped. So we really have to try.
Like most good mitigation, it will probably feel like you're overreacting when it doesn't happen, I say into the world. But I'd rather feel like we all overreacted than wish we hadn't.
That's exactly right. That's so well put. I'd rather feel like you overreacted.
Last plug, that's where I feel like Sarah Kendzior may provide many of us a little good reading. She's not necessarily, the most disability focused, but she sure does know what it's like to be screaming about this for quite a long time and to watch it all happen.
Can you remind me, Babs, who that is? Who would
Yeah, Sarah Kendzior is scholar of authoritarian states,
Okay.
wrote most recent book is They Knew, but coming out with a new one.
Okay, great. Thank you. Well, thanks everyone. I'm probably gonna stop the recording now.
Yes, thank you all so much for coming now and in the future, and we will be getting you those resources. All right, good night.